Having been a doctor in the emergency department for the best part of a decade, here are 5 things that I would not do. And stay tuned for the last one because this affects up to 25% of the world's population. So number 1, I would not use cocaine or any other illicit drugs. I've seen so many people in the emergency department that have presented with drug overdoses, and this includes things like cocaine, MDMA or ecstasy, and even ketamine. Cocaine is particularly dangerous because it causes the arteries around your heart to spasm, and as part of this spasming process they constrict, and this can lead to people having heart attacks. Both cocaine and MDMA can increase your risk of something called serotonin syndrome, which is a life-threatening condition, and they both can lead to overheating. Ketamine has traditionally been used as a horse tranquilizer, and it's really dangerous because it can cause your breathing rate to reduce so much that you can essentially overdose and pass away. Number 2, I would not let my kids have a trampoline. In A&E and also when I've worked in orthopedics, a really common injury in children is that when they're jumping on a trampoline, they might catch it incorrectly and fall off. When they fall off, they can land on their elbow and get something called a supracondylar fracture. This type of fracture is particularly dangerous because there's so many blood vessels and nerves around that elbow joint that the broken bone can damage these structures. I remember one young girl, she was 6 years old. We had to take her straight from A&E into the operating theatre because her hand was white. She had no feeling and she couldn't move it. This was a really scary case, and it's one of the reasons why I wouldn't ever let my children have the trampoline. Number 3, I would never drink and drive. Now again, I know this is illegal, but if you've had any alcohol, it does reduce your reaction time and increase the risk of you having an accident. I've seen many people attending A&E, either by stretcher with an ambulance or with police, because they had an accident because they were inebriated whilst driving. Number 4, I would not put any random objects up my bum. I've seen a lot of these. The stories can be entertaining, but ultimately there is a massive risk of perforation if you're inserting things into the back passage that just should not be there. Cases that have been better for the patient have been when we've been able to remove those objects in the emergency department, but there are more dangerous situations when these objects are lodged so high up that we can't retrieve them whilst in the emergency room. This means we have to get our surgical colleagues involved and we have to take this person to theatre. One of the biggest risks and dangers of doing something like this is that that person may need to have part of their bowel removed, particularly if they've accidentally perforated part of their intestines. This means that they've created a hole and that section of bowel needs to be removed. And finally, I wouldn't smoke. This is particularly important for people who have lung conditions such as asthma or COPD. Smoking makes these conditions so much worse. It also increases your risk of having high blood pressure, heart attacks and strokes.